Yes, hello again, everybody. It's easier for you to understand what this company is doing. I let them say a few words and few slides for themselves, and then we ask a couple of tricky questions about them. So, Jaakko, go ahead.
Thank you. So, I come from the company called PulseOn, and what we do actually is optical heart rate monitoring. So what does it actually mean for the consumers? We make the heart rate monitoring extremely easy. So basically, only from this wrist device, we can read your heart rate all the time. So it's a very small, very light, and practical device that can tell me and measure my heart rate all the time. So why is this relevant for Internet of Things? If we go to the next slide, if there's one thing that you really, really want to measure relating to the wellness from the person, it actually is their heart rate. We can tell extremely well, for example, your activity levels, which of course the trackers already today can do, but we can do it much more accurately looking at your real energy consumption. But we also can tell you how fit you are based on your heart rate, and we can also then detect your stress levels, how well do you sleep, and not only how well do you sleep, but how well does it actually affect your daily balance. So it's really, really good sensor to have in the future devices. And that's where the PulseOn comes on. So if we look at the market on the next slide, it actually is really, really fastly expanding market. So already this year it's predicted that there's going to be 58 million wearable devices sold in this market, and growing to 2017 to 100 million. But what actually, or that already of course is a huge, huge market, but what makes it even more interesting for a startup like us is that the people will not accept data as just as an thing that they want to trust their data, basically. They want to have more reliable data, and they want to understand what it really means. And that's where the heart rate and our company actually comes in, because we can provide much more meaningful data that can then be analyzed by our partners or, of course, our own applications as well. So we see there a huge, huge opportunity for any companies. So if we go to the next slide, so what is our core differentiator? There are actually a lot of products nowadays that claims that they have heart rate monitoring and optical heart rate monitoring as part of their device. The key differentiator in our case is that it works. And it works in different situations. It works when you run, it works when you sleep, it doesn't consume too much energy, and so we can fit it in the very, very small space. And also, the thing there is that we have our own algorithms and knowledge on that. How do you interpret that signal? How do you make it meaningful data? And this is where we really, let's say, differentiate from any other customer or company in the world at the moment, that we can really make the most accurate heart rate monitoring optically. And again, optically meaning it's very easy. You can just wear it on your hand. Another thing there is also that our patented solution gives very wide range of different conditions that it works. As I said, for example, a lot of companies say that they have this optical heart rate monitoring, and they can read the heart rate, but only if you stand still, or only if you are warm, only if you are not in the bright sunlight, only if you don't have tattoos, and all of these. And we have been able to solve these issues. We've been actually working on this technology for over 5 years already as a group. As mentioned before, we are a spin-off from Nokia. We started to work there, but we've been continuing that and partnering with the best players in the world. So we actually believe that we have the best possible solution on this area at the moment available. If we go to the next slide, what our company actually does, we have our own product, and we are very proud of it. It's very good. Today it's sports focused. You can buy it from Verkkokauppa. Please do it. It's always good to have happy new customers. But we also provide that to any company, to themselves, to take it as their own product, and we can modify it, and that helps us also to take our technology further. On top of that, we actually are also concentrating today also in the module business. So not only providing our own product, but because we see that we have a clear advantage here in this area, we also offer this technology to be used by other companies, and we already have customers on that side as well, so that they can actually take our heart rate monitoring, optical heart rate monitoring technology in use. And hopefully in the future there are also other big brands that can claim that their heart rate monitoring works. And that's, you kind of lost the slides, but that's pretty much.
Yes, I think that's a good introduction for that basis. For the time's sake, we need to move to the second part.
Okay, I have only 2 slides. So Mikko Salminen from Velmo. About 15 years ago, there was the second ever Mobile Monday, and I was giving there a presentation about location-based services. We had just built in Elisa, or Radiolinja at that time, a test service that with the text message you could get immediately the location of the nearest Alko. That was the first service on this planet that was really working in a mobile network. Why did it took 10 years after that before the location-based services became widely available? The operators made a decision that we own the location. We are not giving it to anybody, we own it, we do somehow business. But they never managed to do any business. Only when the GPS came to the mobile devices, operators started to realize that they don't own anymore the location of the customer. So they started to play the same game, providing also their network database, so you can easier find out the location of your mobile device. So what's now happening in the health and wellness business? You probably have your own personal health data. Some of you have 80 Excels home or written papers, or then there are hospital systems in Finland, dozens, or municipal health centers where you have your data. You don't know where it is, you don't have any sort of control over that. But we believe that you own your health data, and this is the thing, the same way as with the location services. When people start to own their data, have control over their own data, that's where the game starts to change. If I get to the next slide. So what Velmo is doing, this is also a Nokia spin-off. So when Nokia ran out of money 2 years ago, Velmo was spun out from Nokia. And what we are doing is a system which collects data. You can type in manually the data in the system. There are probably 20 different trackers and more coming all the time. You can connect it to different kind of devices, like I have one wrist device here, hopefully pulse on one day, and that sort of things. I have automatic scales. My bed is equipped with MFIT sensor, so it's measuring my sleep and that sort of things. So at the moment we have about 110 different devices and services where we can collect the data. And the key thing is that you own the data. You have the full control over your data, and you can give access to your health insurance company, wellness programs. Some companies are organizing wellness programs. The model of occupational health and the wellness is quite different in different countries. And we are not selling this application to consumers. There are 15,000 different applications in the App Store related to health. No, we are selling this to these service providers that provide the service to the companies. So enterprise or corporate wellness programs. Companies providing this service to the employees, getting healthier employees, happier employees. So there is a cost benefit analysis can be done, and the payback time is usually months, 6 months max in these kind of services. So we believe that when you own the data, there are more and more devices, as mentioned, coming up, so you can automatically collect the data, and I believe that this is going to be the real game changer within the next few years. Thank you.
Great to hear two great companies presenting. I'm sure there are quite some questions from the audience as well, but I'd like to start with a few. You both mentioned kind of gathering the data and the whole IoT of having consumer data. Do you have big screens on your offices where you monitor how people live these days? I mean, do you really see that data, or is it how's the personal or privacy issues handled in this data?
Okay, in Velmo, you give the permission to the coach to see your data. Because there are occupational health service providers like Mehiläinen and Healthy Diacor providing these services, so your boss will never see the data. Nobody in your company will see the data, but the healthcare professionals who are under legislatory requirements and not to disclose that data. So you make the decision who can see it. Of course, we can combine data. For example, on a company level, you can have a dashboard in the lobby of your company telling that how much people have been walking during the last 24 hours and what's the average sleeping time of people in this company, or competitions between different departments, that these guys are walking more than this, or sales guys are walking more than marketing guys, or something like that.
Okay, good. Now we have two microphones, so I will give next to you. And of course, one big question coming out this summer is Apple Watch, and it's quite big name or brand in this space. So relating to that, so what do you see? What will be next? What's next for your companies? And is Apple Watch, is it good or bad, or what's your kind of things?
No, I think it's excellent that the wearables are getting to the attention they are getting, and of course we are more than happy to partner all of these companies, also the big brands, with our technology. So for us, it's a big opportunity.
Yeah, and more there are devices to collect the data, the happier we are, because the richer database, more you can analyze the data and find all sorts of correlations.
Good. We are running out of time, as you may see. I can give a microphone to you guys, so who has some questions for these guys? You have.
Apple was mentioned, so how about HealthKit? It's kind of similar concept.
It's collecting the data on the device, so they can disclose the data to the healthcare professionals. So we are collecting data from the HealthKit and providing it then further.
Okay, maybe one more question. Who has something to ask from these two companies?
Yeah, for the sensor, do you have any certification or medical certification, something like that, or is?
No, we are working in the consumer field, so no, they are not medical as such, and that's why both companies actually have so far stayed on the wellness side, and it's quite important. But that doesn't mean that we wouldn't have the ambition at some point to be also on the medical side, so definitely in the future.
And it's interesting to see where the border between wellness and medical data is. In the Netherlands, law says that weight is a medical parameter because it's used in BMI calculation. So when I tell my weight over a network, it has to have a strong authentication, which sounds like ridiculous. And big changes there will be in the borderline.
Okay, and I guess as you are showing the minutes are over, so let's give a big hand to you guys, and you'll be around here for more questions over the coffee. Thank you.